Hey guys, I want to go over with you. A lot of you guys have issues with losing weight, and a lot of times people are really doing the right things. They're eating right, they're exercising, and for some reason or the other, that they're struggling with weight loss. And you probably know people out there right now that have those kind of issues. And what I found out, practicing functional medicine in my practice, looking at their urine, their blood, and their stool, a lot of the people that have issues with body fat and weight issues, I found that compared to the average person, they're kind of metabolically broken. In other words, I mean that they could do everything right, but their body does not react the way somebody else that might be lean and muscular. And so that can be helped if the right tests are actually done, and then the body is set or reset, if you will, to get it to start working the way it should be. But in most of these cases, guys, I'm not going to say everybody, but in a lot of these cases, the people, they're not just, shoving pizza for breakfast and lunch and dinner and eating gobs of ice cream and chocolate and milkshakes. That's not really what's happening to these people. These people really are working hard and doing things, but it's just not working out for them. So then you start seeing them cheat more because they're frustrated because they feel like nothing works anyway. Okay? So a lot of times it's their metabolic problems that they have to deal with. And so, when you look at your body and your health, first of all, I want you guys to understand is that, when you have fat cells, people don't really want to lose weight. They want to lose fat. In fact, when you get a big belly, that increases your risk of developing dementia, cancers, and other health problems as well too. It's that fat that sits inside those internal organs that you can make hormones out of. Those things can be really bad for you. So you don't want to necessarily lose weight. You want to actually get rid of fat, okay? And there's two ways really to get rid of fat. Number one, if you want to get rid of the fat cells altogether, the only way to do that is through liposuction. But that's not going to help you become metabolically efficient, because what that will do is when they do liposuction, it's going to actually get rid of only the fat that is in that particular area, but it's not going to actually solve the problem for where the fat is in other areas of the body. And I'm talking your heart, I'm talking of, your internal organs that could really be getting affected and you don't even know it because you look good because you got liposuction. So, we're talking about not just quick fixes, we're talking about overall being healthy. And so then there's a second way is what you can do. Is if you're not getting rid of all the fat cells, then the second thing is actually shrinking or getting the fat cells actually smaller, okay? And so look at it this way, is that, your body, your certain cubic centimeters, cubic inches, whatever you want to say, basically inside the fat, that fat is always coming, in and out of the cell, it's being created and so forth. And so when you're looking at that, if you had like 100 people, for example, I heard this analogy before, you had 100 people in a room, you want to make the room more empty. Well, if one person leaves and one person comes in, there's still 100 people in the room. So the object would be to everything that comes into the room, you want more to leaving the room, and eventually there'd be less people in that room. And so the same thing is with fat. You want less fat coming into the cell and more of the fat actually leaving the cell, so the fat room, if you will, is shrinking. So that's what we were talking about. We were talking about shrinking not only your waist size, but shrinking your cells so that actually the fat is less fat inside the body. So the fat that exits the cell, it's a process that's called lipolysis, I'm sorry. And that process that basically brings the fat into the cell, and the fat that brings the fat into the cell, it's called de novo lipogenesis. So which turns like carbohydrates brings fats into the cells, because carbohydrates are very insulin sensitive, if you will. Okay, so insulin likes these carbohydrates. And so basically when we're looking at that, is that if you look at that, that's all these hormones inside their body, this fat process is controlled through hormones. And so the purpose of nutrition or drugs or hormones, or you're looking at exercising, all of these things like intermittent fasting, we're trying to manipulate those hormones into being utilized so that the fat is used for energy, so that you're getting as much fat out of the cell and being used. And in that process, that's a process called, in the literature, it's called negative fat balance. Sorry guys, I'm moving this around a little bit. My hands are getting a little tired. I've got a little stick I'm holding on to, so it goes up and down like that, okay? So now let's talk about a couple of these things, these hormones, that drive everything. There's hormones out there that are called, for example, like insulin. You guys, I'm sure, have heard of that. And it's not just with diabetes, but insulin actually comes up every time you're eating certain foods and your blood sugar is going up. Insulin comes in, grabs that, and brings it into the cell, okay? Uses for energy. There's other hormones out there, there's called hormone-sensitive lipase. You got your testosterone, you got your estrogen, and you got your cortisol. So those five, in my opinion, some people obviously would disagree, but in my opinion, those are going to be the hormones that are really the big guys. They're going to rule the roost. They're going to be the dominant factors, the major players in the game. There's five people. Those are your NBA stars right there, okay? The five on the team. So how do you manipulate those? Well, insulin seems to be really the most important of those five. And so there's no better way to lower your insulin level really is to not eat, So if I put somebody on Naked and Afraid and I give nothing but water and minerals, they basically would have very low levels of insulin and they would drop a ton of fat. So once that the patient gets into that raging, you guys have heard of this, of ketosis, which would take about 2 or 3 days, that insulin would actually go up in that person, just prevent that patient from developing what's called ketoacidosis. And so if the person is like a type 1 diabetic and they also did that kind of a little trick like that, well, their insulin, body's not producing insulin. So because of that, they'd actually end up dying. So if a person is type 1 diabetic and they go and they're making, those ketones are going way up and there's no insulin that's coming there to control that, they are going to go into ketoacidosis. So really what you want to do if you're not diabetic, you want to be able to manipulate the insulin. And one of the ways you can actually do that, a healthy way, is so that you can burn up fat, is to eliminate and or reduce your carbohydrates. So and why? Because carbohydrates, like I said before, are really the most insulinogenic foods. Now, I'm not going to argue, there are proteins that are also insulinogenic, but they really have a different type of response. So there are patients out there that are really doing everything correctly. They're watching their carbohydrates, they're exercising, they're drinking their water, they're doing all the things correctly right, but yet they can't still lose body fat. And one of the things that we see when I do the testing here at the clinic is we see that their cortisol is through the roof. And so again, that's one of the major hormones that can make you become heavy and tired and fatigued and everything else, okay? So it's really hard to get rid of fat if your level of cortisol is affected, because the cortisol is a very anabolic hormone to fat. So anabolic meaning that it builds up, okay? So it's anabolic to fat, cortisol, and it's catabolic to muscle. And so that's the opposite of what you would want. Catabolic meaning it breaks it down, so which is the exact opposite, okay, so of what you would want. Less like testosterone, right? You've heard of that. It's very anabolic to muscle. It's going to be building it up, and it's going to be very catabolic to fat. Okay, so of course, you got women. Sometimes women, it's going to be very hard for them to, especially if they've gone through menopause, to lose fat and build muscle, because when they've gone through menopause, now they've really affected their testosterone and their estrogen levels. So it's going to be these are very important hormones to help with fat and fat regulation. So in all these that are, people that are stressed out, if you're stressed out and your cortisol is going through the roof and you've never been tested with it, even though you're eating right, you're exercising, you're going to have to make sure that those cortisol levels are getting affected. and are corrected, and there's some natural supplements, there's some natural things that you can actually do when you find out what your levels are. If you're in a stage 1, stage 2, stage 3 phase of adrenal exhaustion, you can really help yourself a lot if you're having issues with weight and hormones and so forth by getting some of those tests done. Okay, so look, I'm not going to tell you that you're not responsible for what you put in your mouth, because you are, but bottom line is, once you've eaten something, it's not what you do, it's what those hormones that are doing metabolically that are going to help you to lose weight and look good and feel good. And sometimes that's not in your control. Again, that's why I said a lot of people that are having issues with weight loss, they need some type of testing to get themselves balanced, because that way, if they get that corrected, they get metabolically correct, they can start losing weight and feeling good as well. Okay, so a lot of these patients, again, they're metabolically broken, and that's why I'm a big believer, an advocate of getting tested and then getting on a proper procedure, so that way you can look good and feel good. All right, guys, take care.